The year 2020 brought an unprecedented global crisis, the COVID-19 pandemic. Countries around the world grappled with the rapidly spreading virus, implementing various measures to protect their citizens. In Pakistan, Prime Minister Imran Khan faced the daunting task of leading the nation through this challenging period. With a fragile healthcare system and a large vulnerable population, Pakistan's response required careful consideration and decisive action. Imran Khan's government faced a difficult choice: prioritize public health through strict lockdowns, or try to balance economic stability with virus containment. A complete lockdown, while potentially effective in slowing the spread, would have had devastating consequences for Pakistan's economy, particularly for daily wage earners and the informal sector. This is where the concept of smart lockdowns emerged as a key element of Pakistan's COVID-19 strategy. The smart lockdown approach aimed to strike a balance between protecting public health and minimizing economic disruption. It involved identifying and isolating specific areas with high infection rates, allowing other parts of the country to function with relative normalcy. This approach aimed to curb the virus's spread while mitigating the socio-economic impact of a complete lockdown. Recognizing that lockdowns would disproportionately impact the most vulnerable segments of society, the government launched the ASAS Emergency Cash Program. This initiative provided direct cash transfers to millions of low-income families affected by the economic downturn caused by the pandemic. The ASAS program, already in place before the pandemic, was rapidly scaled up to address the urgent needs of those who lost their livelihoods due to lockdowns and economic slowdown. This program became a lifeline for millions, providing much-needed financial assistance during a time of crisis. To coordinate the national response to the pandemic, the government established the National Command and Operations Center, or NCOC. This body, comprising civilian and military leadership, played a crucial role in shaping Pakistan's COVID-19 strategy. The NCOC collected and analyzed data, provided recommendations on pandemic policies, and oversaw the implementation of smart lockdowns. It became the central hub for coordinating efforts across different government departments and provinces, ensuring a unified and cohesive response to the crisis. Pakistan's healthcare system, already facing challenges in terms of resources and infrastructure, was put under immense strain during the pandemic. Hospitals, particularly in major cities, neared capacity, and healthcare workers worked tirelessly on the front lines. The government, recognizing the need to strengthen the healthcare system's capacity, allocated additional resources to hospitals and increased testing facilities. Efforts were also made to procure essential medical supplies and equipment from both domestic and international sources to meet the surge in demand. Communicating effectively with the public was crucial in managing the pandemic. The government used various platforms, including traditional media and social media, to disseminate information about the virus, preventive measures, and government policies. Initially, there were some inconsistencies in messaging, but the communication improved significantly, with the NCOC playing a more prominent role. International cooperation was also vital, with Pakistan receiving support from global organizations like the World Health Organization and financial assistance from international donors. Imran Khan's handling of the COVID-19 crisis drew both praise and criticism. Supporters lauded his government's efforts to balance public health and economic considerations, highlighting the success of the smart lockdown approach and the ASAS program in mitigating the pandemic's worst effects. Critics, however, argued that the initial response was slow and indecisive, and that the government yielded too much to pressure from religious groups, particularly regarding the opening of mosques during Ramadan. The COVID-19 pandemic was an unprecedented challenge for Pakistan. The country faced a multitude of difficulties, including a fragile healthcare system, a large informal economy, and the need to balance public health with economic considerations. While there were certainly areas for improvement, Pakistan's response, characterized by the smart lockdown approach, the ASAS program, and the NCOC's coordination, demonstrated a commitment to navigating the crisis and protecting its citizens. The pandemic highlighted the importance of a robust healthcare system, effective communication, and strong social safety nets. It also underscored the significance of international cooperation and the need for global solidarity in the face of shared challenges.